Good morning. Thank you so much for taking time to attend our presentation today regarding HIPAA and the Compliance Toolkit HR Service has available to their clients. If you're having any difficulty hearing this recording, please indicate in the chat box and let me know. The presentation is going to be recorded and made available upon completion of today's review of this new toolkit. I'd like to welcome everybody, and we'll go ahead and take a few minutes to walk through what HIPAA is, what the laws require, and how it might impact your business. Our focus today is going to be more on your smaller employers, those that are going to have fully funded plans in place. So you're using a provider to offer your health care to your employees. And so we won't touch on something that is based around a self-funded plan. So if you were hoping to get that information today, that won't be covered. My apologies for that. But that said, let's go ahead and kick into the presentation. So what is HIPAA and how does it apply to our organization? Well, HIPAA, of course, stands for the Health Insurance Portability and Accountability Act. It was originally passed to protect individuals leaving a company and then starting with another organization without having to meet those pre-existing conditions. Well, the laws, of course, have expanded over time, providing additional provisions to protect individuals and their personal health information. You'll hear that referred to quite often as PHI or EPHI, which is electronic personal health information, along with those rules governing security and storage or transfer of that information across our communication avenues, so through email, through faxes, etc. So employers have to first understand the level HIPAA applies to them, to what level that is applicable. And for covered entities, there are certainly far more strict requirements that come into play. For the non-covered entities, there are only a few simple precautionary or procedural needs that you should take into consideration. So we're going to walk through a little bit of that today, kind of give you an idea of how you make that assessment and protect yourself in the business. So HIPAA's, there are 3 compliance areas that are included in the HIPAA regulations. You've got your privacy rule, which restricts covered entities and their business associates' use and disclosure of individuals' protected health information. So it sets up guidelines that tell us how and when and what types of uses we can use with an individual and employee's personal health data. The second is the security rule, which requires covered physicians' practices to implement administrative, technical, and physical safeguards to ensure the confidentiality, the integrity, and, of course, the availability of the electronic PHI, which I indicated is the EPHI, so that's the acronym you'll often see when they reference the electronic portion of this, which is that security rule. And then last is the breach notification rule, which requires the covered physician practices to notify affected individuals, the Secretary of the U.S. Department of Health and Human Services, or HHS, and in some cases the media when they discover that there's been a breach of a patient's unsecured protected health information. And you'll find that I mentioned a lot physicians' practices. Where this comes into play in particular are for companies who are doing self-funded plans. So you're acting as that total administrator. So you have a great deal more of compliance requirements under HIPAA versus someone who is a fully funded plan that's using a healthcare provider. So HIPAA's covered entities, when we talk about covered entities, they fall into 3 categories. You've got your healthcare plans. So these are your employers offering medical insurance, and that's what I've talked about over the last few minutes, is that you can either offer a plan on a fully funded basis, which means you contract with a healthcare provider, they administer it, you pay the premiums, the employee works through that healthcare provider for all of their needs, etc., and you have very little access to or hands-on the individual's personal health information. So those are the fully funded. We also have the self-funded programs. These are employers who decide to actually fund the health plan themselves. They might have a third-party administrator who helps administer claims, but they essentially cover and take on the full burden of that financial responsibility of individuals' health needs. So they don't contract through another provider and limit those financial obligations. And employers vary depending on their type of organization as to which one works best for them. But today we're going to focus more heavily on the fully funded type of arrangements. The next category is your healthcare providers. So healthcare providers, obviously, these are our hospitals, our doctors' offices. They are very heavily regulated under HIPAA. So that's your second category of a covered entity. And then the third is your healthcare clearinghouses. So these are going to be like your third-party administrators, individuals who transmit, track, and share employee health information between the different organizations for billing purposes, for treatment purposes. So these are your healthcare clearinghouses. And again, they're going to be much more highly regulated. So from a HIPAA perspective, today we're going to focus on the health plan category and how these services can help you. Go ahead and walk through that process, assess your business needs, determine your compliance level under HIPAA, and document that so that should you ever be audited, you have some way of showing that you've gone through that due diligence to say, yes, I'm following or taking every step I can to follow the HIPAA requirements for which are applicable to my business. So we'll continue on here. Excluded from HIPAA, there are only a few scenarios where they are excluded. So if you're a self-insured plan with less than 50 employees and you're entirely self-administered, so when I talk about entirely self-administered, it means you don't use any third-party vendors, you don't have brokers involved, you don't, there's nothing that you share outside of the walls of the business that's done through an electronic fashion or anything to that aspect that would cause protected health information to be lost or possibly breached. These are really far and few between. Most employers have some third-party vendor, somebody outside of the walls of the business, even when they're self-insured, self-funded, that they use. And so this very rarely comes into play. The other types of things that are excluded, there are certain health plans, or well, I should say that are actually not defined as a health plan under HIPAA, and so they wouldn't fall under the HIPAA guidelines. So things like short-term and long-term disability, workers' compensation, and life insurance. From a HIPAA perspective, those plans are not defined as a health plan under the regulations, but dental, medical, vision, those types of things, those are all going to fall under the plan's definition of a health plan. Okay, so protected health information. When we talk about PHI, these are individually identifiable health information, things such as individuals' past, present, or future physical or mental health conditions, past, present, or future payment provisions of health care. So it's not just the actual health need or health issue that's at hand here, but it's payment provisions, aspects of that are also protected. So we talk about all of that individual information that you share with a healthcare provider, a hospital, a surgical center, to either elicit and have procedures performed, or upon having them performed, the outcome, and of course subsequent payment of or negotiation for fees and stuff like that. Those are all going to be considered individually identifiable health information that is protected under HIPAA. So some of our requirements as employers is we have to assign a HIPAA privacy and security officer. This doesn't have to be somebody who specializes necessarily in those types of things, but they certainly want to make sure that they're knowledgeable enough to assess the business needs. But that person, whoever you're going to assign to be your privacy and security officer, they need to be able to sit down and go through and assess the business's risks under HIPAA and how to mitigate those, how to continually monitor them, and put in policies and procedures to protect the business. So you want to assign somebody. That might be HR, it might be somebody from IT, working closely with someone from HR. It might be an owner who, of course, wears many hats. So, but you want to assign a single point of contact, somebody who's going to oversee that to make sure that nothing slips through the cracks. Then you have a requirement to do a notice of privacy practices, referred to as the HIPAA notice. You have to provide that to your employees to indicate what your privacy practices are as a business. And within the Compliance Center, we have examples of what those look like. So you can easily pull one down, provide that to your employees. If you're working with a fully funded plan, your healthcare provider typically will provide a privacy practice notice to the participants under that plan. You determine and track PHI. So when we talk about determining and tracking PHI, what we're saying is that you need to go through and assess the business and all of your practices, your procedures, what you do day in and day out to administer your health plans, to see where and at what point you might come in touch with or see or transmit any kind of protected health information. So you'll determine that, and then you need to track whatever type of protected health information you do manage. You need to track that process, that procedure, to ensure that everything is protected, that there's no possibility of breach, that you're actively looking for those types of situations. So if you are faxing forms, you want to make sure it's a secure fax. If you are emailing medical applications or doctor's notes or stuff back and forth, you want to make sure you're using a secure avenue to do that. So password protection, encryptions, etc. You want to make sure that you're using whatever you have available to you to secure that data. You want to ensure proper handling of PHI. When we talk about proper handling, it's not just from the electronic perspective, but within the walls of the business. So you don't want to have employee information, personal health information laying out on a desk where others can see it, pick up, walk off with it. You don't want to just toss old data into the garbage can where someone can have access to that when it's disposed of. You don't want to leave files and drawers unlocked that contain protected health information so that someone can come in and access those files. The same with carrying on a conversation. If somebody's talking to a healthcare provider about an employee's health issue or protected health information, you want to make sure that you're doing that in a confidential setting, so behind closed doors. So we want to ensure proper handling of protected health information. I alluded to it earlier in this, but protect and secure PHI, so through firewalls, password encryptions. Make sure that the technology we're using to share data from one person to another, from one organization to another, from one broker or provider to another, that we're doing it in a secure fashion. You want to make sure you have in place business associate agreements. And what those are is an agreement essentially that says any provider that you're using, so your brokers, your healthcare providers, if you're using a third-party administrator to administer COBRA provisions or billing provisions of your healthcare offerings, you want to make sure that you have an associate agreement in place with them saying they are doing all they have to do under HIPAA guidelines to be compliant with HIPAA. Most of them are pretty forthright in providing that to you. If they don't, you may want to reach out and give them an agreement to have them sign and return to you to say they are using and following and putting into place the HIPAA procedures they need to ensure that everything is protected and managed, and that they agree to notify you should they experience a breach in that data. Again, the business associate agreement is something we have templates of in the HIPAA toolkit on the Compliance Basics website that you will all have access to. And you could just easily pull down one of those, use that, customize it for your business, and have your businesses that you do business with sign off on those. Then you want to create a privacy, security, and breach notification policy if applicable. So if you're not in a category where you're likely to have a breach, then you're probably going to have minimal type of policies and procedures, mainly that you have your business associate agreements in place to say they'll notify you in the case of a breach. But for somebody who is fully insured or a larger employer where you may be handling a lot of personal health information, that very much comes into play, and you would need to have much more comprehensive and specific breach notification policies put in place and conveyed to those who have a need to know. So this piece of it is not as applicable to your smaller employers and those that are fully funded as it would be to someone else. So that's the nutshell of the HIPAA guidelines and laws. Now what I want to do is actually bring up our website, take you into that website, show you where you locate the tool, what that looks like, and some of the forms that you're going to find or hopefully find useful to you in that process. So bear with me here a moment while I hurry and log onto our system. And I apologize, I should have had this brought up before I started the presentation. All right, let me go ahead and share this so that it's visible. All right, so on our home page, where you go into is over here. We have a login button. You can access it there, or you can go over to our member services page. So for our compliance basics customers and our HR support customers, you would just click on compliance basics. Today I'm going to go into a test site. So this is just for reference to allow you to see the tool. You each should have your own assigned user and password to access this system. Once you go into the Member Services website, on this page, over here is our HIPAA toolkit. Okay? On the first tab, what you'll see is some basic information, essentially what I went through with you just now, talking about what HIPAA is, covered plans, where they fall, some basic compliance steps about how you determine if you're a covered entity, defining things like your compliance officer, those things. They're just recapped here for you so that you have that as a reference, point of reference. Down here, we get into those who fall into that more fully HIPAA compliant relationship. So someone who is self-funded, over 50, they're using third-party vendors, they're transmitting a lot of information, or your healthcare providers, your doctor's offices, those groups, your clearinghouses, they're all going to fall into the category of a much more comprehensive covered entity type of situation where they're going to have a lot of personal health information transmitting back and forth. And so down here we go through a great deal more detail on what they would need to do to assess their business, set up the right procedures, practices, and policies to ensure they're HIPAA compliant. But we're going to focus, like I say, on the basic employer, smaller in size, usually fully funded, and using another healthcare provider. That said, you'd want to go over to the HIPAA forms page. So we've got HIPAA forms, documents, and policies. They're here for you to use. Each one of the links is an active link. It will open a document, providing you access to that document. You'll see things like a HIPAA compliance officer job description. So if you're going to put somebody in place of that position, you might want to make sure that they understand what that looks like. So you have an example here of what that might be. And those will vary depending on the business need. You've got things like a HIPAA breach notification guide. So if you do experience a breach in employee data, confidential personal health information data, you've got the notification guide, excuse me, that you can pull up, and it'll walk you kind of through that. There's a privacy and security article that you can read through if you want to understand a little bit more about HIPAA privacy and security. We've got, and some of these tools I'm going to show you, like this one, the HIPAA risk analysis checklist sample. I'm going to go ahead and bring that over and show you what that document looks like if you were to download it from the website. Okay, so you can see here that the security risk analysis checklist is going to take you through a couple of different categories. It'll tell you steps to look at. So security assessment categories are going to include physical So facilities or other places where patient or employee health data is accessed, computer equipment, servers, mobile and portable devices like tablets, cell phones, and then of course that physical or auditory access to patient data, which I talked about. So making sure that we look at how we are handling that information day in and day out. Your administrative type of things, so designated security officer, workforce training and oversight. So we want to make sure that the workforce we have handling that information is trained on HIPAA and how to go ahead and be HIPAA compliant, to be sensitive to that information and protected in our everyday efforts and administration of our health information and our health benefits. You want to have work information access controls in place, like I said, locked drawers and files, making sure that we shred data that is appropriately destroyed, that we don't leave it laying around or just toss it in a garbage can. You want to make sure and schedule periodic security reassessments. So as the work environment changes, as you put a new software system in place, you want to go ahead and just reassess all of those risks. So you want to have scheduled periodic assessments, reassessments put in place, and that might be in some cases yearly, it might be quarterly. It depends on the environment in which you're dealing with at the moment and the business, the growth, how things change. Then there's the technical, so secure, authorized, electronic exchange of patient information. So you can see that it goes down through all of the various things that you need to assess to determine where risk might exist within your organization. So let's set that one aside, and let's show you a couple more of these ones. We've got and there were a few that I wanted to show you in particular, risk analysis guidelines and samples. So let me bring that one up. Let's see, right here. Okay, so the risk analysis guidelines and sample. This information came right directly from the Department of Labor. There's what they refer to as Stage 1 and Stage 2. But it allows you, and it gets into some of the regulations here, but I don't want to get too complicated about it. But it's going to help you here again, considerations as you conduct your risk analysis. So review existing security infrastructure. In this case, this is medical facility related. So depending again on your type of business, what you do, the environment you work in, this is going to walk you through a little bit more detailed assessment of the same types of scenarios I showed you on the other document. So one or the other is going to be helpful to you, but as you'll see, it just runs down through a lot of the different things, risk analysis requirements under the security role. So again, it gives you a little bit of the actual citing of the actual HIPAA regulation, and then some information about what you need to assess, hardware, software, transmission of security, etc. Again, so it's just a little bit more comprehensive of a document. And let's see, there were two others I wanted to show you today, and that'll wrap up the presentation. I will unmute the line and see if I can address any questions individuals might have. Let's see, let's do the HIPAA coverage and assessment findings. Okay, this is the one that you want to use as a business to go ahead and say, here's proof that I looked through the business. I did all of these steps to ensure that I am or I am not a covered entity, and here are all the things I'm continuing to do to ensure that if that ever changes, I've dealt with it, I've got things in place to handle it. So your HIPAA coverage assessment findings, you're going to indicate, of course, the first checkbox here. After you've gone through all the assessment, I am or I am not a covered entity. In most cases, to a small extent or to some extent, almost every business truly is a covered entity unless you don't provide any type of health plan as defined under HIPAA. So most are going to be a covered entity and have at least a small amount of HIPAA compliance requirements. Here you will identify who the individual is going to be that's going to control and monitor your HIPAA compliance. So that might be the person you name your compliance officer. You put all their information here. Here you'll indicate the types of healthcare benefits that the company offers. So we go through and say, okay, here are all the things we offer. You'll put total employee count, full and part-time. if you're a self-funded or fully funded plan, outside basic enrollment information the company does or does not. So it'll walk you through steps to assess your current environment. You answer the questions, provide the information, and indicate that you've gone through, like this section here, confirm PHI access and use through a review of. So we've reviewed our open enrollment procedures. We've reviewed our new hire procedures, our benefit bid procedures, and that we verified that we do or do not have any access to or use any protected health information. So this document will walk you through that and allow you to capture it, keep it in a single place so that if they come in and audit, you can say, yes, we've gone through it, here's everything we have in place, here's why we aren't, or here's why we are, to what extent. You're going to document all your healthcare provider information. You just capture everything in one little place, the living document, so as things change, you go in and update it, and just keep it in a file labeled HIPAA or a folder or something to indicate that you've done what you need to do from a business perspective to ensure HIPAA compliance. Now I wanted to show you one last document, and this one is a sample HIPAA privacy and security policies and procedures document. This one, if you find that you are using protected health information to any extent, I would suggest using this document as well. So here again, you're going to indicate who you designated as your HIPAA compliance officer, and you're going to go into great detail in here to indicate what you actually put in place. So policies regarding physical access to the building. Here you're going to type in literally the things you have in place to protect access to that information, so physical access to the building. And that runs down through the document. You'll see various categories. Again, you just continue to indicate the types of things you actually put in place to meet each one of these requirements. So if you are, like I say, to any extent, if you are dealing with protected health information, I would encourage you to use something like this document to document all of those procedures very carefully and very concisely, so that you have in place another living document. If you're the person handling this and you're not there, someone can come in and say, oh, wow, okay, here's all of our documents, here's exactly what we have in place, here's our business continuity plan, sanctions, which essentially indicate the types of steps that would be taken, disciplinary types of steps that would be taken against somebody who violates your HIPAA privacy policies and procedures. What that looks like, if it's an egregious violation, it may be termination on the spot. If it's a minor violation, it might be retraining of HIPAA and subsequent reviews over the next 60 days or 6 months or, every year. But you want to document that. And then, of course, document retention policies. That would include things like, there's also a section on destruction, so it would include things like how you're destroying things, what that looks like, how long you retain things, how they're retained. So again, this is another good document just to document all of that information. Because once it's in place, it's just a matter of setting up those kind of annual or quarterly or biannual or whatever is appropriate for your business reviews of the procedures to make sure that you're updating them as things change. But you've got that living document. So, the initial process might take a couple of hours or a couple of days, and it may involve other individuals within the business. But once you've created that and put that in place, then you just continue to reassess the business as the environment changes, and at least annually, I would say, to make sure that you remain HIPAA compliant. Okay, so anyway, a few of these documents are ones that I showed you that are all on here. Like I say, you click on it, it's an active link. It'll open up that Word document from the website. You can customize it, save it, so they're all usable, typable Word documents. And I'm going to go ahead and unmute the lines at this time, assuming I can do that. Let's see, participants. I know there's got to be a way to do this. Okay, hopefully everyone can hear me and you're able to respond. Does anyone have any questions about the HIPAA presentation, things we might not have covered?
Deb,
Yes.
realistically, how often do we really see audits?
I'm sorry, how often do you what?
Realistically, how often do we really see an audit?
You know, prior to prior to the Affordability Care Act, it would have been pretty hit and miss. It would have been more driven by complaints and larger organizations. Now, with the push for compliance with the Affordability Care Act, it's certainly, we're seeing more of it. Wow, I'm getting a lot of feedback on Did that help answer the question?
Yeah, thanks, Deb.
Is there any other questions or?